Welcome to the show, Food for Life, and this is your host, Dr. Saxena. And as I was talking last time about something about heavy metals, and the thing what I've been talking about, I've been working a lot on these days, is metal toxicology, clinical metal toxicology. I'm a board certified clinical metal toxicologist, and I do believe these are the things which are highly toxic to humans as well as the animals. Is the heavy metals. I was covering last time about how these heavy metals cause these chronic diseases and all that. Let us look into some individual heavy metals, how they work it out. The commonest heavy metal what we are facing these days are usually one simple thing called arsenic. Arsenic is a semi-metal, in fact, in the periodic table, and is considered very highly toxic to the animals and the man. It is one of the oldest poisons known to man. Its applications throughout history are wide and varied. Mud used it because it is odorless and tasteless. It was very easy to poison someone with arsenic because it was odorless and it was tasteless. Um, I can tell you only 1/10 of a gram, which is 100 milligrams, can lead to death. What we are facing these days is a chronic arsenic toxicity. This is a cumulative toxin. Arsenic, not in a minuscule doses which keep accumulating inside your body, is a global environmental health problem. It is affecting millions of people worldwide. I've seen scores of people here coming with diabetes and peripheral neuropathy. And the moment we start checking their arsenic levels and we start reducing their arsenic levels, their peripheral neuropathy, everything goes for a toss. They recover within maybe over 4 to 6 weeks. They recover like anything. We try to work on this particular thing. We test the urine test. We try to work with the blood analysis and all that. But most of this arsenic will be there in the chronic tissues. It's there in the kidneys, in the soft tissues and all that, in the neurology, brain thing also. So it's not easily assessed, but unless we do a provocation analysis, things come out. How this arsenic is getting into your human body? Arsenic is usually released in the environment by smelting of various metals, combustion of fossil fuels. Arsenic is added in herbicides, pesticides, and fungicides in agricultural products. The drinking water in many countries, I can tell for absolutely in India, Bangladesh, and they say Southeast Asia, which is tapped from the natural geological resources, is often contaminated as a result of high levels of arsenic in the groundwater. We had seen high levels of arsenic up to the level of 30 plus micrograms per deciliter in water, which we were able to do some tests out here. Arsenic exists both organic and inorganic form, and the long-term health effects can be severe and highly variable. Skin and lung cancer, neurological effects, hypertension, and cardiovascular diseases. This is a big thing, I must tell you. The neurological effects of arsenic may develop within few hours of ingestion, but usually are seen 2 to 8 weeks after exposure. It's usually symmetrical sensory motor neuropathy. Sensory motor neuropathy is as simple as somebody having tingling in the neck, in the hands or feet, some weakness in the muscles and all, often resembling the Guillain-Barré syndrome, where the predominant clinical features are something like paresthesia, numbness and pain, particularly in the soles and feet. We do see in our clinical practice a lot of people complaining with numbness and pain in the soles of feet, and we tell them, okay, it is a diabetic neuropathy, and we are trying to work on that. real problem is the arsenic here. Most of the adverse effects of the arsenic are caused by the inactivated enzymes in the cellular energy pathway, whereby arsenic reacts with the thiol group. Thiol is the sulfhydryl group of proteins and enzymes and inhibit the catalytic activity. So what happens is that this arsenic is going and attaching to the sulfhydryl group of a proteins or any enzymes, and thereby inactivating this particular thing, catalytic activity. Furthermore, arsenic induced neurotoxicity, like many other degenerative diseases, causes changes in the cytoskeletal protein composition and hyperphosphorylation. I think I am too abstract, but I need to give this info. These changes may result into disorganization of the cytoskeletal framework, which is a potential mechanism of arsenic-induced neurotoxicity. Arsenic exposure, how do you pick up? It can be detected, especially in the hair, even after many years. Kind of thing, arsenic has been ascribed with miraculous properties. It was prop, it was prescribed to enhance absorption of the nutrients and help gaining weight. This has been, this is the history of medicine. It was also given to prevent skeletal problems and treat anemia. Not too many years ago, it was suggested giving that small doses increases energy levels. There is a thing called Tyrolian region of Austria, where the well-known arsenic eaters were reported to ingest small amounts of arsenic at specific intervals to increase their physical strength. So, the body can build up a resistance to toxic effects after small doses are ingested over a long time. In fact, some of the arsenic eaters were well known to tolerate the 4 times the lethal dose. But somewhere it has not, the history doesn't tell how these people, arsenic eaters, had a lower tolerance and they succumb. The people having high tolerance, that's okay, but the people who had lower tolerance, how did they succumb? It's a kind of thing we need to look into the common sources. Addition of arsenic from air, water, and food. Tobacco treated with arsenate sprays may also be route of exposure. Soil can be a source of exposure. Children love to play in dirt, and studies indicate that children living near smelting areas shows high levels of cadmium, lead, and arsenic exposures. Water can be a source of arsenic contamination. The Environmental Protection Agency has reduced the previous standards of 50 micrograms per liter to 10 micrograms per liter now. And yes, we do have things, we need to lower the standards. When I talk about this particular thing, I would like to tell you the standards are different for different countries. In Australia, the standard is lower than 10 micrograms, where I live. In India and this place, Bangladesh, and the standards is 50 micrograms per liter. So there is a kind of thing. The arsenic exposure is on the. I give the calmest one more example where the arsenic is used like anything. It is the roxason. It's a arsenic supplement for animals. Arsenic was added to animal food as a method of disease prevention and growth stimulation. This is roxason, a controversial arsenic compound which was approved in 1944 and has been largely used as a nutritional supplement for chicken. There was in 2009 the Poultry Act proposed a ban on roxason, but still things are being continued. So to increase the muscle mass, And for disease prevention in this poultry, this roxasun was added, which has got more than 25 micrograms per kg body weight of I think less than 100 grams, something like that. It's not per kg also. So, but it's a huge quantity, and the people who ingest that particular thing are going for it. Definitely, this is the direct source of contamination. Direct source. Even the fish also sometimes contributes to arsenic in the fish has got arsenic. It has got 1 to 10 grams per gram of arsenic. Shellfish has got highest arsenic. So, so the thing is, what is has to be worked out here is what is this particular thing. I'll give the one more commonest source of arsenic: rice. If it is grown in water containing more than 10 micrograms per liter of arsenic, as in case of Bangladesh as well as India, rice is a potential kind of source. We have Asian rice has got high levels of arsenic. This is the reason we ask our people not to eat that white rice. Try to shift from that white rice to so that Sona Masuri rice is the one thing which is called. We ask people to change from that one to a different rice, which can be something like a brown rice or something like a. There are some other good varieties of the rice. We try to work it out. You have got some biryani rice. You have got some. This rice is not being prepared in this particular water grown in 10 and above uh, arsenic. This particular stuff. So when these people, how I try to infer that these people have got something to do with the arsenic toxicity. When these people come to us, patients exposed to arsenic will have a garlic smell to their breath. The trivalent arsenic poisoning, arsenic is in the form of trivalent as three valencies, not going to the details, but trivalent is the most common arsenic poisoning which affects. It all depends on the chronicity and the exposure. Acute exposures, you get some acute arsenic toxicity, usually present with gastrointestinal symptoms that may make something like cholera, vomiting, and severe diarrhea, which may be rice watery in character, often bloody. The acutely intoxicated patient will be in acute distress, often dehydrated, and in a hypovolemic shock. Whereas when you look into chronic toxicity, it's more insidious and present as classical dermatitis, hyperkeratosis. Hyperkeratosis is thickening of the skin of the usually the palms and the soles. Palmar keratosis we call it, with a classical dewdrops on a dusty road appearance or peripheral neuropathy. They have painful paresthesias, which is symmetrical and stalking glow in distribution. Stalking glow. Only the fingers are involved, and you have got this particular stuff. And they can have something like knee lines over the whitish lines over the nails, which look like traumatic injuries on the fingernails. So what happens with the arsenic intoxication? It is known to produce symptoms such as dark gray skin color, wart-like keratosis on palms and soles, knee bands, knee lines, acne-like skin eruptions, skin cancer, liver and kidney disease can happen, and even the cerebral changes can happen with arsenic, chronic arsenic toxicity. Symptoms of severe acute poisoning are usually, we have mentioned, nausea, vomiting, gastrointestinal inflammation, severe diarrhea, and can lead to kidney failure, respiratory failure, and coma. Whereas the chronic exposure, chronic arsenic toxicity, which is normally we are talking, has been associated with alopecia, loss of hair, dermatitis. You have got something like myalgia, you have got lethargy, your exhaustion, mental confusion, diarrhea and headache, burning sensation in the extremities, constipation, stomatitis, epilepsy and convulsions also can happen. They usually have slow wound healing. When there is a chronic ulcer which is not healing, we used to first think of zinc and all that. Now we started thinking it might be because of arsenic and this neuropathy and all that. So diagnosing is very easy. Try to work with the whole blood arsenic samples. We try to pick it up because it is rapidly excreted to the kidneys, and what happens is that serum and blood are not the samples which detect unless they are picked up soon after, maybe few hours after the toxicity, after the ingestion. If we can take it within few hours, we can find something in the serum and blood. Moderately elevated blood levels may only be an indication of arsenic intake due to diet and other sources. Need to avoid arsenic containing foods such as fish and chlorella, plus highly potential high arsenic sources for 3 days before repeat testing. Urine, it may show mild or moderate elevated arsenic levels, uh, usually due to increased intake of dietary arsenic. Whereas people, if urine concentration is above 50 micrograms per liter, we absolutely advise you to go to a nearest person who is dealing with the metal toxicology. We need to work it out. We need to evaluate the potential sources, and if you suspect dietary involvement, avoid arsenic containing foods for some time. And this is a really challenging thing. About 50 micrograms per liter, uh, he or she has got some big load of arsenic. There are some things tests we try to work it out. Hair and nail analysis, which is a good diagnostic indicators for a chronic arsenic toxicity. Both are the tests which are known to locate long-term arsenic exposure long before the symptoms of toxic intoxication are obvious. We can just pick up before that, before getting into a kind of clinical or it's a rapid kind of classical acute classical arsenic toxicity. Just by checking the hair and nails, we can always pick up then this how much is the toxicity. So we try to work with some of the chelation therapy here. We try to use something like it was used in emergency before. There was a thing called BAL which was used for arsenic, and now we depend more on something like DMSA and all that, which are more easier, which has less side effects, and they are well tolerated in the kids also. So DMSA and DMPS is a simple thing. I just wanted this to be, and along with that, we try to balance this copper and zinc metabolism, and that makes a big this one. So to sum up things, what we had worked on this particular area is if there's a clinical evidence of this one, we try to work on this particular stuff. We start giving some space, work on this detoxification process. We work on some supplementing some good simple things which can be as sulfur containing amino acids. Try to increase the content of vitamin B, which is a very common thing which almost every toxicity we try to work it out. Increasing intake of vitamin E intake, also trying to improve the selenium status in the body. So what happens is that all these things which help the naturally to take these heavy metals out of their body, and this is something regarding arsenic. I thought I must tell all that stuff. What I have been practicing, and I work on this sensory motor neuropathies a lot, and I do see cases people having all chronic diseases irrespective. They can present with hypertension, they can present with CKD, they can present with uh, diabetes, neuropathies, and all that. But they have this high heavy levels of heavy metals, and just by reducing this particular stuff, we are seeing a great improvements which are happening in the patient's level, and this is how we try to working on this particular stuff. So this is regarding arsenic. Thank you.